Bacterial diseases are caused by various bacteria, and laboratory diagnosis plays a crucial role in identifying the specific pathogen responsible for an infection. Here are some common bacterial diseases and the corresponding laboratory diagnostic methods. 1. Tuberculosis, TB, causative agent, Mycobacterium tuberculosis, laboratory diagnosis. Acid-fast stain of sputum or other clinical samples. Chest X-rays for pulmonary TB. Tuberculin skin test, Mantoux test. Interferon-gamma release assays, IGRAs. Nucleic acid amplification tests, NAATs, such as PCR for M. tuberculosis DNA. 2. Streptococcal infections, causative agent. Various species of Streptococcus. Streptococcus pyogenes causing strep throat. Laboratory diagnosis. Throat swab for culture and sensitivity. Rapid strep tests for quick detection of Streptococcus antigens. Serological tests, such as anti-streptolacin O, titers. 3. Salmonellosis, causative agent, Salmonella species, Salmonella enterica. Laboratory diagnosis. Stool culture to isolate and identify Salmonella. PCR for detecting Salmonella DNA. Blood cultures in severe cases. 4. Cholera, causative agent, Vibrio cholerae. Laboratory diagnosis. Stool culture for V. cholerae isolation. Rapid diagnostic tests, RDTs, for detecting cholera antigens. 5. Urinary tract infections, UTIs, causative agents, Escherichia coli. Klebsiella pneumoniae. Laboratory diagnosis, urine culture and sensitivity testing. Gram staining of urine. Urine tests for some pathogens. 6. Lyme disease, causative agent. Borrelia burgdorferi. Laboratory diagnosis. Serological tests, including enzyme immunoassays, EIAs, and Western blot. PCR for detecting B. burgdorferi DNA. 7. Gonorrhea, causative agent. Neisseria gonorrhea, laboratory diagnosis. Gram stain of discharge for identification of gram-negative diplococci. Nucleic acid amplification tests, NAATs, including PCR. 8. Meningitis, bacterial, causative agents. Various bacteria, including Neisseria meningitidis, Streptococcus pneumoniae, Haemophilus influenza. Laboratory diagnosis. Cerebrospinal fluid, CSF, analysis, including culture, gram staining, and antigen testing. Blood cultures. 9. Pneumonia, causative agents, Streptococcus pneumoniae, Haemophilus influenza. Legionella pneumophila, Mycoplasma pneumoniae. Laboratory diagnosis. Sputum culture and gram stain. Blood cultures. Chest X-rays. Serological tests for atypical pneumonia, e.g. Mycoplasma pneumoniae. 10. Syphilis, causative agent, Treponema pallidum. Laboratory diagnosis. Dark field microscopy for direct visualization of spirochetes. Serological tests, including rapid plasma reagin, RPR, and Treponema pallidum particle agglutination (TPPA) tests. 11. Diphtheria. Causative agent. Conbacterium diphtheria. Laboratory diagnosis. Culture and identification of C. diphtheria from throat or other respiratory samples. PCR for detecting diphtheria toxin gene. 12. Legionnaires' disease. Causative agent. Legionella pneumophila. Laboratory diagnosis. Culture of respiratory secretions on selective media. Urinary antigen tests for Legionella. 13. Brucellosis. Causative agents. Various species of Brucella, e.g., Brucella melitensis. Laboratory diagnosis. Blood culture for isolation of Brucella. Serological tests, including the right agglutination test. 14. Tetanus. Causative agent. Clostridium tetani. Laboratory diagnosis. Clinical diagnosis based on symptoms and patient history. No routine laboratory tests for direct identification of C. tetani. 15. Shigellosis. Causative agents. Shigella species. Laboratory diagnosis. Stool culture for isolation and identification of Shigella. PCR for detecting Shigella DNA. 16. Anthrax. Causative agent. Bacillus anthracis. Laboratory diagnosis. Blood cultures. Culture and identification of B. anthracis from clinical samples. PCR for detecting anthrax DNA. 17. Tularemia. Causative agent. Francisella tularensis. Laboratory diagnosis. Culture and identification of F. tularensis from clinical samples. Serological tests, including agglutination and enzyme-linked immunosorbent assay, ELISA. 18. Leprosy. Causative agent. Mycobacterium leprae. Laboratory diagnosis. Acid-fast stain of skin smears. Skin biopsy for histopathological examination. PCR for detecting M. leprae DNA. 19. Plague. Causative agent. Yersinia pestis. Laboratory diagnosis. Blood cultures. Sputum cultures. Serological tests, including F1 antigen detection. 20. Melioidosis. Causative agent. Burkholderia pseudomallei. Laboratory diagnosis. Culture of clinical samples, such as blood or sputum. Serological tests, including indirect hemagglutination assay, IGRA.